it's a really great community of building wealth through health, right? And I tell people, well, what do you mean by that? Well, when you have your health, you're able to go out, make money for your family, feel better, and not always be sick and always be on all these disease processes by taking medication, right?
Yeah, you're able to go out and do your
Right.
best and do what you're passionate about and do it really well because you feel well.
Welcome to Beyond the Scale, where real health gets deeper than just the numbers. I'm Dr. Darren Dubyak.
I'm Alexandra Dubyak, and we are not only partners in life, but also passionate partners in integrative care.
Blending faith,
family,
functional wellness,
and a little life with our dogs.
Because true healing happens beyond the scale.
This podcast does not contain any medical or health-related diagnosis or treatment advice. Content provided on this podcast is for informational purposes only. For any medical or health-related advice, please consult with a physician or other healthcare professionals. Further, information about specific products or treatments within this podcast are not to diagnose, treat, cure, or prevent disease.
Well, here we are again.
We made it past our first episode, barely.
All right, well, let's just get right into it then. So I think we said we would talk about, what is Body by AIM 360. So question number one, what is Body by AIM 360? Where did the idea for Body by AIM 360 come from?
So the AIM part of Body by AIM was the name of my practice before, which was Advanced Integrative Medical 360. And I wanted something sexy or something neat. So I was like, oh, let's call it Body. And I was like, I don't know what that means. And then Body by AIM 360. So more or less that integrative approach to helping your whole body is how Body by AIM 360 came about.
Is there any specific reason behind why you started this business? Because this came along years before you and I met.
Yeah, like I said in the first episode of meeting the Dubyaks, it's, I started out as a chiropractor and we would do chiropractic and some nutritional support. And I was getting people better, but I knew there was something a lot more that can be involved in helping someone get better quicker. If it was medications, if it was food, if it was weight loss. And the evolution was, I almost think about it, what happens if McDonald's just sold cheeseburgers, right? But then sell French fries or chicken McNuggets or whatever, it's people wanted more. So I saw that our patients needed more. And that's why Body by AIM evolved into what it is today.
I love that. Okay, that leads to the next question that I think would be important for people to understand. What's different about us? How do we set ourselves apart from other clinics or practices that are similar to us?
Yeah, so I like that you asked me that. I'm now going to ask you that after my answer. So the number one thing that we do that I can't understand why no one else is doing this is that we blood work the heck out of all of our patients initially.
Well, every patient gets blood work.
Yeah, I mandate blood work. So all that 10,000 patients we've seen, all 10,000 of them have had blood work. It's unbelievable to me still to this day, and it's going to be on almost every episode I talk about. Why are we just not getting simple data, right? We'll fill out a questionnaire and then, maybe you should go keto, paleo, maybe you need B12, maybe, the guessing is ridiculous. So Body by AIM works on data, true facts, and testing, and that includes blood work, genetic testing with our AIM print test, testing over 121 SNPs for crying out loud, gut testing, food allergy sensitivity testing. Testing is everything because it's how we formulate that game plan. You know that, right?
Yep.
I mean, wouldn't you agree, Allie, that is the absolute difference? First off, when you said, well, there's a lot of clinics like us. Well, there's IV clinics, there's peptide clinics.
No, I just said clinics
but do you agree?
that are like us.
Right. But do you agree? Is that the number one differentiating factor to you?
Yes. I also think that we set ourselves apart because we truly pride ourselves in customizing our care for the patient. And we recognize that no two patients are exactly alike.
Right.
And so I think with our process, the patient calls in, they want to become a patient, they have to go through that initial intake phone call, and we go through their thorough health history, collecting all the information, like what are your goals, what symptoms are you experiencing, why are you coming to see us? And they get that blood work done, or they might also do the genetic test and the GI test or a mixture of those things. And then they come in to see us. And we have already ahead of time looked at their blood work, any results that we have. We look through their history and their symptoms, and we come up with a preliminary idea of what we want to do for that patient. And it's custom to them based off of all of that information. The data is so important, and we're not guessing.
So let me ask you, because I knew you were going to ask me. So first off, let's go back. You said the word custom. That word is so, it is so overused, but
well, yeah,
for Body by AIM 360, I challenge anybody out there to have a more customized program than Body by AIM 360. I don't think anyone can do it. And that's why there is a Body by AIM 360.
Yeah. I think that we truly do a really good job of recognizing each individual patient and treating them accordingly to their individual goals and issues.
So what's the 4 types of care we do, right?
Okay,
so there's 4 types of things. Go.
So if I had to break them out, I always try to look at our practice with pillars of things that we do. So I would say weight loss would be the first pillar that we focus heavily on. Well, in my mind, that's how I break it out. The pillars of our business: weight loss, focusing on gut health, hormones, now genetic testing, right? But I guess genetic testing could fall into another category. So I look at it that way, what are the big pillars of things that we do? And overall wellness, truly. But then our services all fall under those pillars, right?
So that's the better question I meant to ask you. So what's our services?
Tied to those things. So when we're talking about weight loss, it could be a mixture of things, right? The programs can look like medications to help assist in weight loss. It can be IV therapy, supplements. Everybody gets a nutrition coach. We know that. It could be, that could lead to other testing that we want to do. If we're focusing on hormones, that looks at testing specifically for hormone-related things, doing bioidentical hormone replacement therapy, supplements, TRT, which is testosterone replacement therapy, for those of you that don't know what TRT is. If you're looking at the gut health part of it, almost all of those patients, they still get blood work done, and they have to do that advanced GI map stool test for us. And then their treatment plans could look like a combination of any of those things too. IV therapy, maybe medications, depending on what's going on, supplementation, nutrition coaching. So yeah. And the genetic test, obviously, that kind of can fall into any of those categories, because there's things on our genetic test that we built that genetic test, right, with those pillars of our business in mind. We picked genetic SNPs that fit the mold for the things that we are really good at in our practice, that complement as extra information for those different pillars of the business. So, the genetic testing it could go into any of those, right? Because the things that we find on that genetic test tie into all of the wellness pieces that we tackle.
So how long are our programs initially?
So we typically will do a 60-day program. It just depends, but between 60 and 90 days is the initial program. Then everybody comes back in and they have a follow-up visit. We kind of reevaluate and see, hey, what's going on? How are you feeling? If we recheck labs or other testing at that 60 or 90-day mark, it gives us a new baseline of where you're at 60 or 90 days later. And then we make our recommendations from there moving forward.
So one of the things I wanted you to highlight on that 60 or 90 day, guys, is every person gets retested again. Every single person gets blood work at least redone in 60 to 90 days, because it shows you a comparison of 1, 2 to 3 months later.
Well, you say that, but if their blood work is perfect to begin with, and we're just focusing on symptoms, we don't recheck blood work unnecessarily. So
99%, guys, 99% we recheck. So the 4 pillars, like Ali said, that really differentiates. So everyone gets lab testing. Everyone gets some sort of testing. It's IV therapy. It is medication of some sort via peptides, GLPs, possibly things like in that nature, right? Number 3, nutraceutical supplements, and 4, health coaching. See, I believe Body by Aim is so different because every single person works with a health coach the entire length of their program. So I don't care. Listen, we have pro athletes that come here, to grandmas, to CEOs of companies, medical doctors are patients of ours. Everybody gets a health coach.
Everybody.
And I'm screaming it because I want to scream it on top. Everybody. Because
Listen, remember we had a patient that was a registered dietitian and she didn't think she needed a health coach, but we were like, no, you do.
And not
It's
only
our
did
way.
we saw how good her results were.
It's our
So-
way, sister.
And that's the thing. It's let Allie and I lead. See, all of our practitioners with all of our employees, so all of our staff and all of our practitioners are trained by Allie and I. So we call it the AIM method or the AIM process, right? So Body by AIM is a trademark company that I trademarked 5-6 years ago. And I was like, listen, we have to have this method, this treatment protocol of how to treat each patient. And then it branches out into this amazing customization of care because everyone's different. I always tell people it's hilarious. This is why it took me 8 times. Oh man, maybe no one will come to me after this. It took me 8 times to pass the SATs because it was so standardized. I couldn't get it. But as soon as the test was given to me orally, I passed it. I was able to do it, you know?
Wait, it took you that many tries?
7 times, actually. I took the ACTs twice.
No.
Yeah, it was pretty bad.
What?
I
Well,
thought you
wait.
knew that about me.
No.
Yeah, that's a whole nother episode.
But I thought the SATs were something that you took and they just gave you a score. You mean like you had to pass it and get a certain score for like college, or what are you?
I couldn't break 750. So for everyone over 35 or 40 or however old we are and 45 and 50, I couldn't break 750. And I had to take all this testing. And then they were like, well, let's try you doing the test orally. And I got 1,000. And I was like, I'm done taking this thing. And
You're like,
got into college. I'm done. Graduated 8th in my class, but could not pass the SATs past the 800.
I mean, everybody's different.
But with Body by AIM, and again, that's how I formed this because, guys, there's so many health and wellness clinics, and I don't want to poke fun at any of them or just, like,
Yeah.
no, I kind of do. I kind of do want to nudge everyone. You have to really challenge me by showing me there's anything more custom than Body by AIM 360, right? Our care, our patients, they became our friends. It's an amazing process. And it's just not a 60 or 90-day program. So many of our patients do our maintenance program, right? And our maintenance is where they're working with us from using our app or things like that. But it's a really great community of building wealth through health, right? And I tell people, well, what do you mean by that? Well, when you have your health, you're able to go out, make money for your family, feel better, and not always be sick and always be on all these disease processes by taking medication, right?
Yeah, you're able to go out and do your best and do what you're passionate about and do it really well because you feel well.
Yeah. And again, the evolution of Body by AIM 360 continually happens, right? So like Ali said, weight loss, you need to find someone better in the business than us.
Mhm.
Gut health, again, find someone better in the business than us. And with hormone therapy, guess what? Same thing. When you do those 3 things very, very well, I believe that's a lot of healthcare, because that's what people are searching for. That's what we want, But anyways, I think on the next episode we're going to do, I know you guys are going to check us out again. It's going to be on peptides, right? There's a lot of, that's the buzzword, right, Allie?
Peptides are a big deal and people don't understand them. They don't really know what they are. They don't understand the practical limitations, within the country of what, because get it anywhere, but it's an important topic for us to educate on because there's a lot of information and there's a lot of stuff going on that people need to know in order to be careful and make smart decisions for themselves.
And I think that's where we should go on this next one. Either peptides, GLPs are peptides. Maybe think we should talk about GLPs because they have been a complete game changer in the weight loss and health world, right? Just like Just like the iPhones completely changed everything, GLPs really changed
They
medicine.
came in and they shook it up.
They did. Just like my wife keeps yelling at me, everyone, because I keep hitting my desk and it's shaking.
You've been really good this episode.
Because I am not touching anything. I'm back. It's like, oh my gosh, should I do? See, this is what it's all about. So I think we talk about beyond the scale being a little bit about faith, family, and our fur babies. We haven't seen our fur babies yet because I'm at the office. We know Allie's at home and the fur babies are upstairs. And I can't believe they haven't even barked yet. So
they're not upstairs. They're down here with me. They're just very quiet.
Oh,
they're good puppies.
Well, listen, we love you. Thank God for their health. And thank God I have you. And hey, first couple of integrative care, the Dubyaks coming at you on the next episode. Mrs. Dubyak, why don't you sign us off?
We will see you next time. Beyond the Scale.
See you guys.
Thanks for spending time with us on Beyond the Scale.
If today's episode helped you see your health differently,
like the show, share it,
and we'll see you next time on Beyond the Scale.